Good morning. Today we are going to discuss about a developmental disturbance affecting the shape and size of teeth, which will be covering fusion and concrescence topic. So first presenting here a case scenario. A 10-year-old boy was referred to a pediatric dental clinic with the chief complaint of unpleasant appearance of an abnormally large anterior teeth. So he had no relevant medical history or family history, and there was also no previous trauma to the teeth or the jaws. This is a clinical picture of the patient which shows an abnormally large permanent maxillary central incisor. You can see the size of the tooth is not okay. It is relatively larger than the adjacent teeth. So this was a radiograph taken for the same patient. You can see that there is a union of some structures here. So the tooth was surgically removed. So this condition is referred to as fusion. Fusion refers to the union between the dentine and or enamel of two or more separate tooth germs. This fusion can be a partial one or a total fusion, and this occurs between the teeth of the same dentition, or it may occur between a primary and a supernumerary tooth or a permanent and a supernumerary tooth. The etiology or reason for this fusion is believed to be the influence of pressure or physical forces producing close contact between two developing teeth. When there is a close contact between two teeth germ, that leads to necrosis of the intervening tissue. This can occur as a result of any trauma or environmental factors such as thalidomide exposure, embryopathy, fetal alcohol exposure, or hypervitamin. So this is a clinical picture showing another condition of fusion of teeth. These are other pictures showing a clinical picture as well as a radiograph of fused teeth. So classification of fusion was given by Aguilo et al., according to which there is type 1 which has bifid crown and a single root. In type 2 fusion there is a large crown and large root. In type 3 two fused crowns with double conical roots are seen. In type 4 two fused roots, the crowns are almost similar to type. This is a picture showing the different categories of classification of fusion by Aguilo et al. The case scenario 2, an 83-year-old woman was referred for extraction of her upper left first molar teeth. An OPG was taken which showed horizontal bone loss and an apical area associated with the mesial root of upper left first molar tooth, which showed resistance to removal of the teeth. Despite of the periodontal detachment, there was a huge amount of resistance offered because of the fusion that has occurred in the. So this particular type of fusion which occurs in the roots is referred to as concrescence, which is a rare dental anomaly whereby the adjacent teeth are united by cementum alone. There is no fusion of the enamel or dentine. The teeth are fused only at the root level. This is most common in maxillary molar region. It can be classified as true concrescence and acquired concrescence. In true concrescence, there is an actual union occurs as a result of close approximation of adjacent teeth during development. In acquired concrescence, as a result of inflammation, additional cementum is deposited in the teeth, which leads to fusion of. This can also be classified as generalized hypercementosis and localized hypercementosis. In generalized hypercementosis, the patient presents with hypercementosis of almost all the teeth of the dentition, which is usually seen in conditions like Paget's disease, acromegaly, rheumatic fever, and thyroid goiter. In localized hypercementosis, there is usually thickening of cementum in the apical third of a single. Both these conditions do not require any specific treatment, but you have to be very cautious while extracting this teeth because they may be associated with even maxillary tuberosity fracture and oroantral fistula formation. How to differentiate between a fusion concrescence and a condition called a gemination? The number of teeth in fusion as well as concrescence is 1 less than normal. The root canal systems are separate in both fusion and concrescence, whereas it is common in gemination. The tissues which are joined would be enamel, dentine, cementum, and pulp in gemination. And in fusion, there is union of enamel, dentine, and cementum, whereas in concrescence, there is a union that is occurring only at the cemental level. In all the conditions, the teeth are macrodont, that is, they are larger than the usual size. Thank you.